All right, welcome everyone. Thanks again for joining. For those of you that don't know me, my name is Suzanne Morley. I'm a health promotion program coordinator with the Wisconsin Institute for Healthy Aging, or WIHA. And I'm really excited to welcome you to this webinar of Understanding Older Adult Alcohol-Related Falls in Wisconsin. If you're not familiar with WIHA, we are a nonprofit administrator of evidence-based healthy aging programs and practices. And we also convene the Falls Free Wisconsin Coalition, which is bringing you this webinar today. If you're not familiar with the Falls Free Wisconsin Coalition, we are a statewide falls prevention collaborative made up of falls and injury prevention coalitions, as well as community-based organizations, health and managed care providers, public safety and EMS, and then others who are part of a movement to reduce older adult falls in the state. If you're interested in learning more about the coalition or getting involved, information will be shared on how to do that towards the end of today's presentation. And I'll also be sharing a link to the coalition's website and going through that in a little bit more detail. So if you're not already a member, you can be made aware of future learning opportunities like this and stay up to date with the statewide falls prevention work. So we've been talking about alcohol-related falls in Wisconsin for some time now, really trying to understand why Wisconsin has such a high rate of older adult fall deaths. And we know that there might be many reasons for that, including differences in reporting, Wisconsin's fun winters and the snow and ice, and maybe even alcohol. So we aim to look further into the alcohol data, and with the conclusion of this webinar, a report with alcohol-related falls data in Wisconsin will be made available for everyone to dive a little bit further into this topic. So for today, we have a few different speakers to kick us off. So Maureen is going to be talking about the impacts of alcohol and aging and kind of just paint that picture of what it looks like in Wisconsin. Elena is going to go into a high-level overview of the alcohol-related falls data and discuss the methods and limitations of the data. And then we have Dr. Weston, who will provide a description of types of alcohol-related falls injuries. And then I will wrap us up by sharing where you can find the report after the conclusion of this webinar and talk a little bit more about the Falls Free Wisconsin resources that are available. This webinar is being recorded, and feel free to throw questions in the chat throughout, and there will also be some time for Q&A at the end. We're extremely grateful to have Maureen with us here today from the Wisconsin Alcohol Policy Project, and they were an instrumental partner in helping developing the data report and to help us better understand the impacts of alcohol as we age. So Maureen, I will let you take it away from here.
Thank you so much. I'm pulling up my PowerPoint, and hopefully you can see that.
Looks good.
Great. Thank you for that introduction, Suzanne. Just briefly, we are the Wisconsin Alcohol Policy Project. We are housed at the Medical College of Wisconsin at the Comprehensive Injury Center. And our focus is really providing training, tools, and technical assistance to reduce excessive alcohol consumption. And of course, to understand, the impact of excessive alcohol consumption. So quick pop quiz, so folks can put this in the chat. What's the #1 drug used in Wisconsin? So I can't see the chat, but if folks want to.
I'm looking at it now and see lots of alcohol coming through.
Excellent. And what is higher, alcohol or opioid deaths? Again, throw that in the chat.
And lots of responses again for alcohol pretty unanimously.
Great. I remember being on a webinar not that long ago where people were answering other drugs, but the data is pretty clear. So the top line here, this green line, is our total deaths, and this is 2022 data. If you look at this orange line, you see 1774. So those are acute alcohol-related deaths. So those are from injuries like falls, but also suicide, homicide, alcohol poisoning, and those types of things. And then the bottom line, which also needs focus, right, are opioid-related deaths. So again, these numbers are from 2022. I'm happy to say we're seeing a drop in some of the alcohol attributable deaths. And I believe we are seeing some of that in opioids as well. But I did want to share kind of the split between those. So the difference between the orange line and the top line are chronic diseases related to alcohol consumption. Alcohol is a major cause of death worldwide. And so this is 2023 data where we're about 3,200 deaths in Wisconsin. So that's just under 9 deaths per day that we see related to alcohol in Wisconsin. And this map shows the percentage of people who are drinking alcohol excessively. So that every county in our state exceeds the national average. And so this is a concern because in Wisconsin, it goes through the lifeline. So we've definitely got kids that are drinking. We're still a little bit higher than the national average for underage drinking. And then folks in the middle age, binge drink, drink while pregnant. So these are definite problems, or are heavy drinkers, meaning 1 or 2 drinks every day. So this, I think, really helps because this is the disability adjusted life years. And so this looks at injuries. So we see injuries being a real cause of harm for folks related to alcohol when folks are younger. In middle age, we see that we've got chronic conditions such as cancer, as an example, and then cardiovascular disease when people get older. And I wanted to just show where we've been in terms of our alcohol attributable deaths over time. And then over 65, alcohol accounts for almost 41% of folks. So it's a significant portion of people that are dying, frankly, because of alcohol use and alcohol related harms. So some examples of what those harms are, which we'll talk about in the data, is that our ER visits go up. And this is especially true for our middle age or older people who drink. And prescription drugs. So this is specifically talking about opioids, but alcohol can be a problem with other drugs as well. And so when the doctor says, you shouldn't drink alcohol, that's really important. And, I personally know of folks who have had some alcohol while they were on other medications and fell, and not everybody made it. So it's a real issue that we need to pay attention to. Also, I know the Surgeon General report came out on this, and I did want to point out that breast cancer deaths are linked to alcohol consumption. Again, not something everyone thinks, and I know we're talking about falls, but I did want to just paint a picture. And that alcohol-linked death rates for women have increased over the last couple of decades. We're finding also that younger women are drinking more than men. So bottom line, this causes, disability and injury. It does kill folks from all ages, and it definitely requires a public health response using our evidence-based and evidence-informed strategies. So what am I talking about when I say excessive alcohol use? So for binge drinking, it is 4 or more drinks for women, 5 or more drinks for men. Any alcohol consumed by those under 21. Heavy drinking is really 1 to 2 drinks a day for men and women. And this is not something you can save up. This is on a daily basis. And of course, any alcohol use by those who are pregnant. So just quickly, 1 standard drink. So the first one on the left with the beer is about 5% alcohol, but not all beers are just 5% alcohol anymore. So that's something to pay attention to in terms of how many servings of alcohol you're having. And then we go through malt liquor, wine, fortified wine, the liqueurs, excuse me, brandy, cognac, and then a shot. So it's really important to know what you are consuming. And sometimes it's not always clear when you're at a bar or a restaurant or even grabbing something off the shelf. It's really important to take a look at that so that, you can make sure you're drinking, staying with, what you plan on drinking versus drinking something and finding that that was too much. So we have a lot of materials on our website about what the issues are related to alcohol harm, policies, enforcement, permits, licensing, a number of tools, and frequently asked questions. And we also, there's a lot of resources on what effective policies are. So the book, Alcohol No Ordinary Commodity, is a great book that details all of the research on this and just came out a couple of years ago. And then the community guide also gives us a really clear idea, what are these effective policies that can help reduce alcohol-related harm? We also have the State Council on Alcohol and Other Drugs report that offer effective strategies in Wisconsin and gives a number of things. So while I think it's important as families and communities to talk with folks about their drinking, especially as they're on prescription drugs and as they age, because it impacts you differently as you age, it's also important to think about what do we do as a community to send a signal that we don't want to encourage people to overconsume alcohol. And so I think some of these are really helpful strategies. Some that we focus on are looking at density, so where you buy or are served alcohol. Having every place sell and serve alcohol that is in business seems like not every state does that, but we tend to do a lot more of that in Wisconsin. I had a bakery down the street that was selling alcohol. There's really no need for that. And then place of last drink, a polled is a way of tracking where places are over-serving alcohol so that we can, educate those license holders or figure out, like, is it a recreational area or park? So that we can reduce that. I know this isn't, some of these are not as relevant to the falls piece, but some that are the SBIRT. So that's the screening, brief, interview, referral, and treatment. And so that's SBIRT. And that is an important piece that can help older adults understand their use of alcohol and then make some change to it. Most people who binge drink don't have an alcohol use disorder, or it has not been diagnosed. And so it's important to understand that there are things that folks can do in order to reduce their use of alcohol so that they can stay safer. And of course, raising alcohol prices is also an effective strategy to reduce how much someone is buying alcohol. This can be helpful for you or your family to kind of check what is your alcohol use, and these slides will be available. So just wanted to share that resource with folks because it's important not only for you and your family to understand where you are and how you want to go forward. So that's that. And we're happy to support communities as they look at how do we reduce falls, how do we deal with alcohol-related harms in our community. So that's all that I have.
Thanks so much, Maureen, for all the great information that you shared. And I do see Felice from your office on the call too. So I just want to thank you both for all of the great partnership and talking me through all of the different things, helping me to better understand alcohol use as we age. It's been super helpful and you guys do some great work. So any questions for Marie,
Thank you.
feel free to throw those in the chat. But again, we'll have some time for Q&A towards the end too. I am going to share my screen again and pass it over to Elena. I've had the pleasure of working with Elena for the last 1.5 years or so to help collect and analyze this data. And she's really gone above and beyond to help ensure that we are able to paint the picture of the data in Wisconsin. So she's going to give an overview of some of the data in the report and share how to use it. So Elena, I will advance your slides for you. Take it away.
Okay, thanks so much, Suzanne. Yeah, it's been a pleasure working with you and your program as well. So I'll just quick introduce myself. My name is Elena Andrachek. As Suzanne said, I'm an epidemiologist at the Wisconsin Department of Health Services. I work in the Bureau of Environmental and Occupational Health on the Wisconsin Environmental Public Health Tracking Program team. So before I begin, I just want to tell you a little bit about the tracking program. The Wisconsin Tracking Program is a CDC-funded program along with a network of other funded states and cities across the nation. We've been funded since 2002. Our program's goal, among many things, is to compile Wisconsin environmental health data and house it in a centralized place on our website to make it easy for our stakeholders to access. Among our many functions, we provide data and resources in a variety of ways through data dashboards, county profiles, surveillance briefs, and peer-reviewed publications. We do have access to a lot of different data sources, so we do often collaborate with our users to respond to data requests, which is our involvement in the Falls Free Wisconsin program, who requested data about alcohol-related falls. So today I'm going to present to you my methods and results from an analysis of alcohol-related falls among older adults in Wisconsin using surveillance data. Next slide. So as Maureen described, alcohol use is pervasive in Wisconsin. In adults age 65 and older, the effects of alcohol may be felt more quickly and can increase the risk of falling. After this webinar, you'll be able to read through the report from Falls Free Wisconsin called Understanding Alcohol-Related Older Adult Falls in Wisconsin. And they did a really good job on this report, so I'm excited for you all to be able to look at it. In this presentation, I will provide a high-level overview on what is available in that report. I'll describe the methods and definitions we use to analyze the data, and I'll also present trends in hospitalizations, emergency department visits, or ED visits, and deaths from alcohol-related falls in Wisconsin. And finally, I'll also discuss some medical costs of alcohol-related falls. Next slide. Before I present the results of our analysis, I do just want to go over the methods we used to obtain our alcohol-related fall records among older adults using hospital discharge and vital records data. Next slide, thanks. So data for this analysis was sourced from the Wisconsin hospital discharge data and vital records data sets. These databases contain information on Wisconsin residents who were discharged from the hospital or emergency department and Wisconsin residents who died in the years of the analysis, which was from 2017 through 2022. We limited these records to adults age 65 or older and identified fall-related incidents using ICD-10 codes. So ICD stands for International Classification of Diseases, and 10 just means it's the 10th revision of these codes. The ICD-10 system is used to code and classify medical diagnoses and conditions to bill patients for their healthcare utilization. And it's a really common to use ICD codes to identify medical conditions of interest in hospital discharge data. And the same codes are also used in our vital records database. In this analysis, fall-related hospitalizations, ED visits, and deaths contained an ICD code for accidental fall anywhere in the record. Alcohol-related falls contained an ICD-10 code for accidental fall and at least one ACD code for a diagnosis of alcohol abuse, use, dependence, or alcohol intoxication. This analysis was focused on adults aged 65 and older, but we did also look at adults aged 40 to 64. And just a quick note that the ICD-10 codes that were used to identify alcohol use in this analysis were also the same ones used in a similar project by the Minnesota Injury Data Access System. So that's where we got these codes from. So I just want to go over some of the measures that we calculated in the report. The simplest one is count, which is simply the number of records that met the case definition. So, for example, the total number of hospitalizations that had an ICD code for accidental fall and alcohol. The crude rate is the count divided by the total population and multiplied by 100,000 to make it a rate per 100,000 people. An example of a crude rate is in 2022, there were 29 hospitalizations per 100,000 population among people aged 85 or older. The age-adjusted rate is similar to a crude rate, it's just with age taken into account. And it's advisable to use age-adjusted rates over crude rates, especially when comparing different geographies like counties or different states. And then the final measure I'll talk briefly about are confidence intervals. Because the rates we calculate are actually an estimation of a true value, we use confidence intervals to depict a range of value in which a true value lies. For example, we estimate that the crude rate is 29 hospitalizations per 100,000, but with confidence intervals, we can say that we're 95% sure that the real value is actually between 19 and 38 hospitalizations per 100,000. So confidence intervals can give us an idea about how certain we are of an estimated rate. Okay, so now that we're done talking about some of the measures in the report, I do want to go over some of the specific results of our analyses. So this line graph in green depicts the number of deaths from alcohol-related falls among people aged 65 years and older from 2018 through 2022. So from 2018 to 2022, the average number of alcohol-related deaths among older adults averaged about 20 annually. However, in 2022, we recorded 35 deaths. We found that the number of alcohol-related fall deaths among people aged 65 or older has increased, especially since 2020. We also found modest increases in alcohol-related ED visits and hospitalizations among this age group. These results are consistent with research in Wisconsin that shows that alcohol consumption and binge drinking has increased since the pandemic. Wisconsin already has a higher prevalence of binge drinking compared to the rest of the US, with 7% of Wisconsin residents aged 65 or older reporting binge drinking compared to 5% in the rest of the US. And this bar graph compares the crude rates of ED visits for alcohol-related falls between age categories in 2022. In this figure, 65 to 69-year-olds had the highest crude rate at 113 ED visits per 100,000 people, and people aged 85 plus had a crude rate of 29 visits per 100,000. We found that the rate of alcohol-related emergency department visits decreased incrementally with age. However, we also looked at age groups of folks between 40 and 64 years old and found that the rate of ED visits for alcohol-related falls peaked among people aged 55 to 59, who had 132 ED visits per 100,000 people in 2022. This pattern is consistent from 2017 through 2022, with the 55 to 59 age category as the peak of ED visits in each year. The peak age of alcohol-related hospitalizations and deaths was a bit older, with people aged 65 to 69 having the highest rate of hospitalizations and deaths. In comparison, when we looked at ED visits, hospitalizations, and deaths related to falling alone without the influence of alcohol, we found that the highest rates of all three medical outcomes to be the highest among the 85 plus age group. One interpretation of these results is that drinking alcohol may taper off in older age groups, making adults aged 55 through 69 the most susceptible age group to alcohol-related falls. Folks on the other end of the spectrum, the 65 to 69 group, had the highest rate of hospitalizations and deaths, possibly indicating a higher rate of alcohol consumption coupled with the higher susceptibility to complications related to accidental falls. We found that white males make up the majority of alcohol-related ED visits, hospitalizations, and deaths in Wisconsin among older adults. However, it's important to note that these percentages are not related to the risk of alcohol-related falls. It's simply a reflection of the most common demographic that's seen in EDs or hospitals for this condition. If we were to compare race or sex-specific rates of alcohol-related fall medical outcomes, it would tell a different story, and we would get a better idea of which demographic is most at risk. It can be difficult, though, to calculate rates for race and ethnicity specific categories because smaller populations can make the rate estimates less stable. Analyzing healthcare costs, we found that ED visits and hospitalizations for alcohol-related falls have increased substantially over time. Among older adults, Medicare paid for 88% of hospitalizations and 93% of ED visits for alcohol-related falls. It's also important to note that the average cost of alcohol-related fall visits was higher than the average cost for accidental falls alone without alcohol. Rates of medical outcomes of alcohol-related falls among older adults tend to be higher in northern Wisconsin. This result reflects the statewide distribution of drinking habits, with heavier drinking typically happening in more northern counties. However, these rates can vary considerably from year to year, and many counties have less than 5 alcohol-related ED visits, hospitalizations, or deaths annually. And because some of these counts are pretty low, this map can kind of shift pretty considerably from year to year. So just best to keep that in mind when looking at county level data. Okay, so now that I've gone over some of the results, and I know I went over them pretty fast, and we'll have time for questions after this, so feel free to raise those up to me if you've got questions after the presentation. So in conclusion, I just wanted to highlight several key points that we garnered from this analysis. First is that both the rates and costs of ED visits, hospitalizations, and deaths from alcohol-related falls are increasing among older adults in Wisconsin. We saw drinking habits increase in Wisconsin after the pandemic, which in turn may have increased the morbidity and mortality related to alcohol, including accidental falls. Medical costs are more expensive than for alcohol-related falls than accidental falls without alcohol and are also trending upward. And Medicaid shoulders the brunt of medical expenses in older adults. Another important highlight is that while ED visit rates for alcohol-related falls were the highest among people aged 55 to 59, hospitalizations and deaths were the highest in older folks aged 65 to 69. And this may be because the 65 to 69 age group are still indulging in alcohol, but are older and therefore more susceptible to complications from falls than younger folks. And then just to close, just wanted to mention several limitations that you should consider when you're looking at this report. The COVID-19 pandemic impacted the counts and rates of ED visits and hospitalizations in 2020 and 2022, since people were discouraged from utilizing these services except in dire situations. So this might be an explanation for why rates may have dropped a little bit in those years. So this should be considered when comparing data from these years to past and subsequent years. And particularly in county data, I already kind of mentioned this, but there were some instances of rates being calculated from counts of less than 5. And then these rates are unstable due to small sample size and should be interpreted with caution. To get a better look at what these counts mean, it's kind of best to aggregate these data over multiple years to get a more stable rate. And finally, alcohol use may contribute to health impacts like poor nutrition or other health factors that could cause a fall, but it might not be captured as a cause in a medical record or a vital record. Therefore, alcohol use may actually be underestimated in this data, since if that alcohol use ICD-10 code wasn't present in the record, we wouldn't have picked it up as related to alcohol. And then finally, just wanted to say thank you to the Wisconsin Institute of Healthy Aging and to Free Falls, Wisconsin, for requesting this analysis and helping to bring these results to light. As noted in the report, which will be available after the webinar, although falls among older adults are common, they don't have to be a normal part of aging. Things like limiting or abstaining from alcohol can make a difference in reducing accidental falls in older adults. So thanks for attending this webinar and for sitting through my presentation. And I think we've got some time left for questions.
Awesome. Thank you so much, Elena, for giving that, high-level overview of all the data. And thanks again for all the work that you did compiling and analyzing all of that data. There is a quick question in the chat before we move on to Dr. Weston. So there's a question if 2023 or 2024 numbers are available yet.
There are, and when we were working together, Suzanne and I, like she said, it's been kind of a multi-year time frame that we were working on this. So those data could actually be added to the report.
Yeah, definitely. I was going to say the same thing. This has been a longer process, but we do anticipate, updating this data in future years. And then there's also a question about showing the Wisconsin map again, and you'll actually have access to that real soon. I'll show you where you can find that so you can look at that in some more detail. I'm going to now turn it over to Dr. Weston. So Dr. Weston is here today to discuss the impacts of, those alcohol-related falls, injuries, and how alcohol affects us as we age. So Dr. Weston, I will turn it over to you.
All right, thank you. Good morning, everyone. I appreciate Free Falls, Wisconsin for inviting me to participate, and we can jump to the next slide. So we're going to talk a little bit about alcohol-related falls. We'll start with the prevalence of alcohol-related falls. So alcohol increases the risk of falls in older adults. This probably isn't too surprising for anybody. Of course, alcohol makes falling more common. It also makes these visits far more expensive. So when you look at the emergency department and the cost of visits, visits that include alcohol are about 8% more expensive. As you can imagine, so I do work in an emergency department. It's harder to perform an exam on somebody who has alcohol on board. It's also a lot harder to trust the findings from that exam. So that leads to more advanced diagnostic imaging, longer observation periods, and of course, we'll talk about this in a little bit, but more injuries as well. Now, these fall injuries are more prevalent in certain parts of the state. We see them more in the northern parts of Wisconsin, but to be sure, it's throughout all of Wisconsin. A lot of fall-related injuries are presenting to an emergency department, and a lot of fall-related injuries are causing significant morbidity and mortality. We see these related falls and these related injuries much more in older populations, although they are all across the age ranges. But the 50 to 59, 60 to 64, 65 to 69, these are the age categories that have the highest rates of alcohol-related falls. And then we're seeing increasing trends. You can see this off to the right here, increasing numbers of alcohol-related falls, specifically in older adults over time. And you can see over the last few years, things have significantly ramped up as well, as we've heard about previously in the presentation as well. That QR code in the lower right is just a quick CDC tool. It assesses alcohol use and makes recommendations for decreasing alcohol use as well. Although we'll talk about, Maureen touched on it a little bit, but we'll talk about kind of what safe levels of alcohol is and how that definition is really changing. And we can jump to the next slide here. So why does alcohol increase falls? So for anybody listening who's had drinks, it's probably not too much of a mystery why alcohol increases rates of falls. But we can get a little more specific than that. So when we look at how alcohol impacts the brain, it affects the areas of the brain that are helping with motor and helping with coordination. And if you've seen somebody who's been drinking or you've had a little too much to drink, you can certainly feel how it affects your motor and coordination. And that is especially true with somebody who's older and maybe already has some difficulty with balance, with coordination. And there's other factors there as well that we'll come back to. Now, this sort of impairment leads to postural instability, which can, of course, cause falls. And then older adults are more sensitive to the sedative effects of alcohol as well. So when you combine this, some motor issues, coordination issues, trouble with stability, and then more sedation, of course, you're going to have more falls because of those brain-related impacts. We can jump to the next slide here. And so we talked about the brain-related things, but there are other things that are significant risk factors for alcohol-related falls. So we talked about older age as a risk factor. It's not just that instability that comes with older age, but it's also slowed alcohol metabolism. And so it just takes longer. That one drink acts differently on somebody who's older as opposed to someone who's younger. Now, older folks are also more likely to have other medications on board. And as Maureen talked about a little bit, those medications can interfere and interact and compound the effects of alcohol as well. Now, other things, these pre-existing health conditions, there's a whole list, but when you think of things like diabetes, chronic pain, cognitive decline, kidney disease, stroke, arthritis, also mental health issues like depression. All these pre-existing health conditions can make people more prone to falling in general, regardless of alcohol, but can compound the use or the effects of alcohol as well. There's also increased sensitivity among older adults. Again, one drink is not the same in an older adult as one drink in a younger person. Women are more likely to have injuries from falls than men. Part of this is due to increased osteoporosis in women, which not only increase the risk of falling, but of course increase the risk of injury when somebody does fall. And then, of course, the amount of drinks. More drinks, long-term drinking can have effects that can compound over time and lead to more likely risk of falls. And we can jump to our next slide here. So the types of injuries that people have from falls, I've been working in the emergency department for about 14 years now. I think I've seen just about every injury people can have from falls, but some are certainly more common than others. The head and the face are the most injured body parts from alcohol-related falls. Your head falls further than any other part of your body. And so if something is going to get injured from a fall, it's most likely to be your head or your face. These are extremely common injuries. It also leads to challenges with diagnosing. We talked about increased cost for fall-related visits. With somebody, excuse me, who doesn't have alcohol on board, it's fairly easy to determine whether they have the heightened risk of a certain type of head injury that would need a CT scan, a CAT scan, for example, than somebody without falls or without alcohol on board. When you have somebody who does have alcohol on board, it's just harder to do that exam. Is their mental status different because of the amount of alcohol? Is the mental status different because they have a head injury? It's really hard to tease out. And getting a blood alcohol level, a 0.2 on one person is very different from that same level on another person. And so it's not a real helpful test to determine whether that's what's causing the person to be confused and altered. And so it just leads to increased testing on folks who have alcohol on board as well. Lots of other serious injuries that are more frequently noted in people who have falls. Again, a lot of these are related to the head, traumatic brain injury, bleeds around the brain, but then also a lot of internal injuries, internal abdominal or thoracic in your lungs and your chest injuries, which certainly contribute to that increased mortality. Fractures are more common in folks with falls or with alcohol on board with their falls. And then, of course, that subsequent immobility that happens after the fall. It's not just what happens right in that moment, but it's what happens in the days, the weeks, the months, even the years after that fall that can lead to a lot of ongoing morbidity and subsequent mortality as well. So this slide doesn't have to do with falls, but I couldn't help but put it in here, especially with everything that's been coming out from the Surgeon General to raise awareness, but really raise awareness on research that's been happening over years and years and years, and is probably not new to a lot of the folks on this call. But we do see from his report and from the research that it cites that alcohol is a major contributor to different types of cancers. It's actually the third leading preventable cause of cancer in the United States. 100,000 cases and 20,000 cancer deaths are related to alcohol. You can see on the right here the at least 7 types of cancers that are related to alcohol use. And so the Surgeon General talked about the increased risk of cancer with increased alcohol use, called for a label on alcohol-containing drinks, and talked a lot about prevention. And this is where we get back to the safe levels. So there's lots of different kind of safe levels of alcohol use out there, but what we're finding more and more is that there's not really a safe level of alcohol use, whether it comes to falls or whether it comes to cancer. And so in the end, I think the take-home message is to reduce your alcohol use, you're going to find health benefits. It's going to be cancer-related health benefits. It's going to be fall-related health benefits, but it's also going to be just everyday related health benefits, whether that's related to sleep, whether it's related to maintaining a healthy weight, being able to exercise, mental health. There's a lot of effects that alcohol has. So does this mean you can never have a drink in your life? It doesn't, but does it mean that if you're having a drink or a couple drinks every single day, you should really think about it and try to cut back? I think it does. And we can jump to the next slide here. So just to kind of wrap things up here, and I'm happy to take questions. Alcohol, as we all know, can exacerbate falls, but it also can lead to much more severe outcomes and increased cost to our healthcare system when alcohol is associated with that fall. The impacts of alcohol are variable, and a lot of this is due to age-related changes, including changes in metabolism. We have to consider the medications that people are taking and how that affects falls. We can't forget, even though we're talking about falls, it's such an important issue. We can't forget the increased risk of cancer that more and more research is showing us is related to falls. And then ultimately, it's an important goal to try to reduce our alcohol intake and think of ways to do that and think of ways to help others around us do that as well. All right, and these are a few resources, and then with the QR codes next to them. And then for the last slides are just a few ways to stay in contact. Thank you.
Awesome. Thank you so much, Dr. Weston. Super, helpful to hear information from someone who's been in the field and really kind of seen the effects of people that have drank alcohol and had a fall. I do see one question in the chat. Does alcohol lower blood pressure or cause orthostatic hypotension?
That's a good question. So the answer a little bit is yes and no. So there are times where alcohol can certainly lower your blood pressure, especially in the short term. Alcohol can cause lowered blood pressure, and that can cause that increase in falls. Now, sometimes over time, especially as you stop drinking, especially as that alcohol is kind of wearing off, it can actually cause an increase in blood pressure. So it can kind of go both directions, but related to falls, we'd certainly be more worried about a decrease in blood pressure that can make people lightheaded and more prone to falling.
Awesome, thank you. Well, feel free to keep dropping those questions in the chat. I am just going to briefly go over the Falls Free Wisconsin website and then share where you can find all of the great data that has been shared. So if you haven't been to it already, our website is fallsfreewi.org. We have tons of information on here, not only for you as professionals working in the field, but then also for older adults. So I'm just going to hit on some of those main points. On our home screen, there's links to different things throughout the website. There's a few videos, we do articles at the bottom. And then older adults can also subscribe to our consumer newsletter. This Prevent Falls section is primarily for information for older adults, their family members, caregivers to find information. We have a falls risk screening, information on how to have conversations about falls with family, caregivers, healthcare providers. We have some stories from real people throughout Wisconsin that have shared their stories about how a fall has impacted their life, what to do if you do fall, how to get up from a fall. A whole section on falls prevention for caregivers, and then where to find a falls prevention program. And then we also have different sections related to some of the things that we know can increase falls risk. So assistive devices, balance and strength, footwear, medications. I'll just jump through one of these quick. There's links throughout, helpful resources. There's videos, how to manage medications safely. So lots of great resources on here. And on this medications page, there's a little section related to alcohol as well. We also have an interactive home safety challenge. So research does show that most falls do happen at home. So this interactive home safety challenge goes through a real Wisconsin home that was staged with some fall hazards. You can go through and interact and find different tips that can help you reduce your risk of a fall at home, and things that you might not have been aware of that could increase your risk. And then we also have the downloadable checklist for the home safety challenge as well. Section for professionals, we have lots of great information. We have resources on evidence-based practices for falls prevention. Some local examples are listed there. Data, which I'll get to in a second. This How to Help section has some different examples of referral systems, presentations, best practices for hosting a falls prevention awareness event, different things like that. We also have news and updates, a newsletter for our professional subscribers. We have tons of great promotional resources as well. So if you're looking to share more information about falls prevention, not only related to alcohol, but just in general year long, we do social media campaigns, newsletter articles, press releases, all of those information that you can just plug and play into your own social media or newsletters. More information about our Falls Free Wisconsin Coalition and how to join is here. Or if you're interested in expanding your work and starting a coalition, we have a whole toolkit related to that. And of course, they're always available for technical assistance as well. But I'm going to jump here to the data page, which is why we're here. We do have lots of data on this page that you can look through. We have a Falls data by county, a link to the EMS and Falls report that was released in 2022 or last year. I can't remember exactly when it was, but we have lots of great data here, and then resources for where to find available Falls data. So if you're looking to, collect some additional data, you can find some more resources there. And then this Alcohol in Falls button is where you will find the full report. So it is live on our website. You are more than welcome to go to it now, but you can scroll through it here, or you can click on the download icon here to download and look through. But what you'll find in the report is the information on the health impacts, the statewide data, the cost data by county. We have some resources and the methods and limitations. So it begins with, talking like Maureen was sharing and Dr. Weston about how alcohol impacts us as we age, goes into the data summary, statewide data, and you can see in here there's a couple of sections. So we have some key takeaways, and then what's included, cost data by county, which is again where that map is, and there's a few other maps on the spreadsheet. Why it matters. So we know that we really talked about that today, why it matters, why prevention and screening and messaging for alcohol prevention is super important. A whole list of resources, including the Drink Less, Beer Best campaign from the CDC, and that alcohol use screening tool that was shared a couple of times during the webinar already. And then there's a couple of other things too. So we have a fact sheet that you can take and share for older adults in your communities. So feel free to download this. You can download this one page using this button here. That also links to the alcohol assessment as well. Definitions, the methods of where the data came from, and then notes and limitations. So all of the data in the sections related to different, the statewide data, the county data, and the cost data, that data is all on the spreadsheet. So you'll click on the download the data button, and that'll bring you to the alcohol-related Falls data, so where you can actually see the numbers. And on the document, it shows you which tab to go to see the data. And you can see that here. So there's a few different tabs. You're going to go statewide by age, 40 to 64, 65 plus. And you'll see there's emergency room visits and hospitalizations, the cost data, again for ED visits and hospitalizations, data by county, and this is where you'll find those maps that you can see. And this is for 2022 and 2017. Like I said, this is all live on the website. I will drop the link for this in the chat. But for now, we have some additional time for questions for any of the speakers today on the webinar. Just look in the chat here. So is there somewhere to find comparable data with Wisconsin to neighboring states? It's a good question. Elena, you had alluded to the Minnesota project. Do you know if that's publicly available?
Yeah, I think like on a lot of tracking program pages in different states, they'll share data like this. So you could check out like the tracking network. I guess that's kind of where I would recommend to start. Also, CDC has a lot of also kind of statewide data on their national tracking program website. I can include that link in the chat.
Mm-hmm. Yeah, on the data page as well, you can find also, CDC is a great resource on where you can find data. It might not be alcohol related Falls data to compare, but Falls data in general that you can find to compare to neighboring states. We have a Falls for Wisconsin data work group, and we just talked about this yesterday on our meeting that Minnesota has kind of comparable rates to Wisconsin, but Illinois' rates are a little bit lower. So there's a project currently in the works actually to look at that as well. Any other questions? Feel free to drop in the chat, come off mute. Okay, well, I'm not seeing any come in. Again, just want to thank all the speakers for the webinar. Lots of great, resources were shared. Lots of great expertise on the call. And again, thank you all for helping to compile this report. A recording of this webinar will be sent out by the end of this week, and everyone who registered will receive a copy of the recording and the report, and it'll be added to the Falls Free Wisconsin Coalition's listserv to stay up to date on future initiatives. So welcome any questions after this webinar, as well as you kind of take time to look through the report, look at your county level data and all of that. Welcome questions after this. Thanks, everyone.